as the ovary. Now, this is the area that we target, is the cervix. Now this is this part. Anyone will scrape, after scraping, we take them to the laboratory, and this one is anyone we are going to get under the microscope, and then they'll get different types of cells, even they are precancerous. And then when we classify them according to the grade, we know how to determine as to what type of treatment to get. I hope you'll go hard. Then there is breast cancer, mammography. Now breast cancer is a disease, it occurs mostly in women. And there's at least about 1% of women who will acquire breast cancer. Because we do have breasts, and then there is breast tissue. And then I know people tend to think it's a misnomer for a man to develop breast cancer. And then 1% of men do get breast cancer. Now, we've got 3 ways actually to scan or to screen for this. The number one is genetic counseling and testing, because we know breast cancer is genetically transmitted to the offspring. And then if a patient comes with a lump in the breast, and then it's examined and then it's found it's a solid lump, then we have to inquire from the family whether there is a family history or not. And then if there is, then we are going to screen for a gene called BRCA. There are 2 of them, BRCA1 and BRCA2. Don't worry about the names. The BRCA1 is a more aggressive breast cancer, and BRCA2 is a less aggressive. So that should be scanned and screened, but fortunately, you screen only once, because once you have screened and we have found that you've got that gene, unfortunately, there's nothing we can do about it, but you can plan to at least do prophylactic mastectomy, or retrocede matrele before the cancer comes. Because we know how if you've got this BRCA2 gene, anymore it's an aggressive gene, I mean it's a gene for aggressive breast cancer. You are likely 75% chance that you get breast cancer. So the best is just to remove the breast before it comes. And the second thing is to check the estrogen acceptability of the tumor. Because once that lump is diagnosed, there's going to be what we call a needle biopsy. We're going to put, okay, this is just a, this is a mammogram, which should be done every year to all women above 24. If you're a woman above 24 and have never done this mammogram, please go and do it as early as Monday, Tuesday. Okay, and then you do it every year. And then that lump, once you have found it, you find this lump from mammogram, okay? We put a needle in here, and then we send it to the laboratory to check what type of cells are there. There's 2 types of breast cancer too. The one not necessarily related to virility. The one is called an aggressive one, the other one is non-aggressive. So, because this grading after the needle biopsy have been examined under a microscope, it will determine as to what type of treatment should be given. Now, nowadays, breast cancer treatment that it has been modified. Breast cancer, therefore, remove the breast. No. You can only remove the lump and you can remove that part and then give this patient either chemotherapy or radiation. You know what chemotherapy is? Is that medication which makes people very miserable when they have had chemotherapy. I don't know if there's anybody who has had chemotherapy. Cancer, and he had to be subjected to chemotherapy. It's very uncomfortable. And the other thing is radiation as part of modality treatment of breast cancer. So, breast cancer is actually a leading #1 cancer which takes women, followed by cervical cancer, which I've just spoken about. So, can we pass the breast cancer? Are we okay? Are we okay in breast cancer? Okay. And then we got this one, which is colorectal cancer. But now, the way colorectal cancer is the area between this is the anal region. You go up, that's the sigmoid, alright? That's the sigmoid, and then that's the ascending colon, that's the transverse colon, and this is the descending colon, that's the appendix. Now, this colorectal cancer is everything from here. It includes all these things here. So the only way that you can pick up this cancer is after you have established colon, the patient may be having breast cancer, i.e. passing stools, dealing with the bloodstream, and then has got the irritable bowel syndrome, well, alternatives are diarrhea and constipation, and he's got spastic abdominal pain syndrome, or you can't determine what the cause is. When you do a scan or an ultrasound, you don't find anything. And then the last thing that you have to do is to do this colonoscopy. That is to put a pipe here, it will examine, right up to the appendix here. And then you can come up with a diagnosis here, colon cancer or rectal cancer, depending for which organ. So if you find a polyp like here, you biopsy that. Biopsy means take a little bit of meat there, and you take it to the laboratory, and then when it comes back, they'll tell you whether it's a benign or it's a malignant tumor. Meaning, is it cancerous or is it not cancerous? So, but this one, colorectal colonoscopy, you do it every 5 years. You don't do it every year like breast and cervical cancer screening. You screen this only once. If you don't find anything, you won't find it until the next 5 years when you do repeat the screening. And then it used to be only in the Caucasians and white people of American descent, but now it has come to Africa. We never used to have colon cancer, just written at all. But nowadays our diet has changed so much more. Every system in the body, it can be colon, it can be the chest, it can be urinary tract. They've got what we call microbiome. The microbiome are those organisms still over there, everywhere, wherever there is secretions, the body. You protect the human body from being infected. Now, with our diets, we have killed those microorganisms, and then we've exposed ourselves to things like the cancer, the infections, and other illnesses. As I'm saying, we now used to have them until we were westernized and taking Western food. Not that there is anything wrong with Western food, but for an African, Western food is not good. Now, let's come to prostate cancer. Now, we have done women, now we come to the prostate cancer. What I can say is that now, prostate cancer may not exhibit noticeable symptoms in its early stages. But however, as the disease progresses, symptoms may include things like urinary problems, painful urination, blood in the urine and semen, pain in the pelvis, erectile dysfunction. And advanced symptoms is bone pain, weight loss, fatigue, loss of appetite. But all these are the signs of breast cancer when we've already missed it altogether. So, what? Prostate. Prostate, yeah. Right. Now, what is the prostate? That's the bladder. That walnut organism, organ there, is called the prostate. Now, the function of a prostate is to produce semen, which helps the spermatozoa to swim towards the target in the ovary. And you know what the target is. So if you don't have the prostate, then you're going to have dry ejaculation, which is not very good for fertilization. Now, it's either what we call benign hypertrophy, that is just swelling of the prostate, which when you do examinations, you don't find any cancer at all. Or you've got a cancerous one, which you have to deal with it according to the protocol, the cancer treatment. Now, to screen for this, you have to do this uncomfortable maneuver called the digital rectal examination. I know many, I don't like this. And it's part of the screening. When you get to the clinic, and then it's unfortunate, we don't have many nurses. Okay, we do have, but very few. Then it's done by a woman, you see that?
Yes.
And then we have refused.
More uncomfortable.
So, you do that digital rectal examination. Now with this finger will check whether there are swellings there or whether there are any other lobules. They will indicate to you as to what type of treatment to give this patient, because as I've alluded to the symptoms there, low urinary flow can mean you've got a hypertrophy, meaning the enlargement of cancer. But it's got treatment that, they give you some medication, Urinex, and then we are able to can pass urine usually, everything normal. And then after you've done a digital rectal exam, we do blood tests for PSA, which is prostate serum amylase. Now, the serum amylase is non-specific to prostate, but specifically if it's high, then we know maybe this patient has got prostate cancer. And then what we do it every year. We must screen for it every year. And then we look at the trend. We don't just do a once-off treatment and then determine as to whether you want to operate or what do you want to do, chemo, radiation, or whatever. So we look at the trend. It should be 0 to 4. But if the trend tends to go up 5, 6, 7, then you must do what we call pre-biopsy MRI, magnetic resonance index. Now, as soon as this PSA is high on the examination, then we are going to do what we call needle biopsy, and we are guided by the ultrasound. Now, with the ultrasound, they still have to put that long pipe at the back so that they can guide the needle exactly where to take the biopsy. But this has become unpopular, the ultrasound has become a little bit unpopular because of inaccuracy. They have missed some cells, with the ultrasound. So they've gone to what we call, what is that the test now? I'll tell you just now. It's a PET test. It's a PET CT scanner. More it's now increasingly recognized as an important staging tool, because it's going to give you exactly what stage the patient is at, and then it will show you exactly where the cells are, and then it will show you exactly where to put your needle to aspirate for the cells. Now, once the diagnosis is made, then there's different modalities of treatment. It's not one size fits all. You can wait and see, or you can operate, or you can give chemotherapy, or you can give radiation, either externally or BRCA, meaning implanting radiate cells in here to kill the cancer. So it all depends on the staging. But once we are clear that you've got prostate cancer, please be very, very religious on visiting your doctor, your urologist, because nothing kills. Many may have gone there for the prostate cancer. But picked up early by screening, then the cancer doesn't have a chance of able to take your life. Now let's come to the, I hope you're okay with the prostate. Okay, ask a question if you want to ask, but let's go on when you ask questions. Let's come to the non-infectious diseases. You know, hypertension, diabetes, hypercholesterolemia, obesity, and others. We call them non-communicable diseases. You can't acquire hypertension because I've got hypertension, and then I'm next to Mr. Mukwena can infect him with hypertension. No, it doesn't work that way. It's either you inherit it or you acquire it if you don't follow the rules and regulations of diets. Now, when we speak about hypertension, we speak about the pressure which is exerted on the blood vessel. Now, as the heart pumps, it beats these walls, and then with a sphygmomanometer, the sphygmomanometer is this instrument that we use to measure the blood pressure. Once it hits, it gives you what you call a systole, and then you read it there, and then when it relaxes, it gives you the systole, the diastole, which you also read there. And then these hypertension go according to grades. You see? Now, there is mild, moderate, and severe, depending on the readings. So we put them on this thing, acid to excess that. There is 85, there is 135 to 85, which is mild. And there is 140-90, which is moderate. And there is 160 plus over 120, which is severe. Now, those blood pressures are not treated the same. Though you will be getting the same medication, which are antihypertensives, and they work according to the mechanism they normally are manufactured to control your blood pressure. And then if you are diagnosed with hypertension, you must also be religiously visiting a general practitioner who is going to monitor that. Now, hypertension, we don't know what the cause is, but we know that 95% is genetical. You inherit it from your parents, and the rest is because of lifestyle. Like, if you've got stress, a lot of stress, if you're at a sedentary position all the time, you're seated in the office or something like that, you don't exercise, if you eat a lot of salt, and then you don't like eating salt-like products, and then if you take, what is this thing now? Herbal medication. Now the herbal medications, not all of them, are dangerously causing hypertension, but there are those which are, you can find them at the pharmacy, in the front part, but there are other herbal medications which are